All right, are you taking Synthroid or levothyroxine? If you are, there's some important interactions that you need to know about to get the most benefit from it. So first of all, we need to talk about your liver function. Now, most doctors, most pharmacists are going to gloss over this, but here's the important thing to remember. When Synthroid or levothyroxine, that's a generic name, is T4. So that's 4 iodine molecules. And in your body, T4 is essentially considered the inactive thyroid hormone. It does have some activity, but we consider it that. It needs to be converted to T3 in your body. So if you're taking Synthroid, your body has to convert it to the active form of your thyroid hormone. But for that to happen, a lot of that conversion happens in your liver. Your liver function has to be on point. And to kind of drive the point home, you also need to have good nutrient function, a good diet, because it also requires vitamin A and other things, by the way, but vitamin A is a big one. So T4 and vitamin A are required to get cholesterol into your cell. From cholesterol, we start making your steroid hormones, whether it's testosterone, estrogen, what have you. So your liver function is critical to you being able to get the most benefit from Synthroid. Now let's talk about a couple of supplement interactions. The first one is if you're taking calcium. Now, calcium along with iron, which I'll talk about here in a second. Calcium, very common supplement found in a lot of multivitamins. It can actually decrease the absorption of your Synthroid or your levothyroxine. You want to space out any calcium consumption, whether that's vitamin, mineral, multivitamin, or whether that's something like milk. You want to space that out by 4 hours. Okay. Now with iron, it's the same story. It can decrease the absorption of your Synthroid. The good news is not quite as big of a window. You want to space out iron consumption from your Synthroid dosing by at least 2 hours. Next, let's talk about a fruit, grapefruit, gaining a lot of steam nowadays as far as being considered a miracle fruit, which I don't necessarily agree with, but another topic, another time. What grapefruit can do is decrease your serum concentrations, and so you're not going to get as high levels of T4 in your body, which is the Synthroid. It can decrease it by up to 11%. So again, if you're consuming grapefruit, we got to space that out by 4 hours. Doesn't matter if it's the fruit or grapefruit juice, space it out by 4 hours. Coffee is another one. Now, I do want to say coffee to me has shown some evidence to interact. I don't think it's a huge interaction. However, I wanted to mention it because coffee is so popular. To be on the safe side, I would space it out by an hour if at all possible. Another supplement nutrient interaction is vitamin C. What they found is that if you take vitamin C with your Synthroid or your levothyroxine, you're going to see a decrease in TSH, which is your thyroid stimulating hormone. As the name implies, you're stimulating thyroid production. So as that TSH goes down, we can see T4 concentrations increase, okay? That's versus just Synthroid alone. So what we're thinking with vitamin C is that it's actually going to increase the absorption of your Synthroid. So that's something to keep an eye out if you're taking vitamin C. Now let's look at some prescription medications you need to know about. First one is any meds that you're taking for GERD or reflux, gastroesophageal reflux disease. These are ones like PPIs. A good one is Prilosec. We can see sucralfate. We can also see just common antacids, which, by the way, a lot of them contain calcium. So that's one of the big issues there. But the bottom line is, a lot of these GERD medications are designed to decrease the acid in your stomach, also something that I'm not a fan of. However, if you're required to take it, as the acidity in your stomach goes down, you need that acidity to absorb the Synthroid or levothyroxine. So that's something to keep in mind. The next one is bile acid sequestrants. That's a fancy term for saying, for example, one of the medications is called cholestyramine. It can actually decrease Synthroid or levothyroxine, decrease the absorption of it. So I realize this is a huge list, but if you're required to take Synthroid, if you're required to take levothyroxine, first thing we have to have happen is it's got to get into your body. We have to have good liver function so that you can actually convert T4 to T3 and get the benefit of it. The other thing is we have to watch for these interactions. So let me know in the comments, guys, if there's other topics that you'd like me to cover. Also, make sure go grab your free checklist. Lots of other things there, natural things that can help you get away from drugs and surgery. So I hope the video was helpful. See you in the next one. Thank you.